So I did that treatment pushing on the right side of the ligaments to the right of the coccyx, and then I pushed directly onto the left side of the coccyx, pushing it to the right for 5 minutes. And now I can spring your mastoid, I can lift it up towards me, inducing upper cervical left side bending. So the body's reflex compensation up high is no longer present. Okay? Mm-hmm. And let's have you lie on your stomach. So now when I palpate both sides of the coccyx, I'm pulling up really firmly, and there's no longer a deeper sulcus on the left. And now when I come onto the left side of the coccyx, I can take up the slack, and now there's a lot of movement. I take up the slack and then I add a little thrust, and there's a little bit of a bounce. We now have movement there. And you'll recall the sacrotuberous ligament was tight, and now I can indent that. Now there's a distinct small amount of bounce of spring in that ligament, and that's normal. And then the sacrospinous, hopefully we're capturing it here, and there's bounce there where it was not before. Can you tell us how you felt walking?
Yeah, it was. It felt like I had a better swing to my hip and leg, and it felt somehow felt more secure, stable.
Nice, nice. And so you sat on a firm surface, but you said it would take longer to find out if sitting is more comfortable.
Yeah, I think I'll know better, by tomorrow in terms of driving back to the hotel.
Yeah. So we'll refilm tomorrow and mention your response to sitting.
Okay.
And the other treatment that I would like to do is just gently work on the soft tissues in the area. Just work with real gentle, sustained, mild pressure to reduce sensitivity in the soft tissues, and just increase your brain's awareness of this part of your anatomy. Sometimes that alone can be very therapeutic. You can read up on brain mapping. It's an interesting subject.
Okay.
So I'll stop filming now, and so this is the response to treatment of what appears to be a left side bent coccyx. And the beauty of the evaluation and treatment is that it's a one-time treatment, and as other cases show that I've posted on YouTube, it is a 1 or 2 time treatment, and they do extremely well. I've been told the coccyx doesn't side bend that way, and that it's bad language, that it that it makes people feel like they're vulnerable and their bodies are broken and all that, and I just can't agree with that assessment. It's a movement assessment, it's a positional assessment, and you retest those things. But based on the response of the patient, it's a very positive treatment. So anyway, that's a little bit of controversy that's out there. Thanks.